We were talking about men's health, men's hormones, testosterone, free testosterone. Can you go a little bit into how that applies in your practice and how you guys utilize, take care of men's health and all of that?
When we talk about different peptides and all this stuff like that, the first thing you need to do is do a proper history and physical on a particular patient so you can learn, what's going on with them, what problems they're having, and see if there's any type of physical issues that you can kind of see just by doing a simple physical examination. The second thing is lab work. Lab work is crucial, especially when you're talking about
the methylation test.
Well, that's one aspect. Initially, just good old fashioned blood work to see where your blood is. What's your hemoglobin? What's your hematocrit? What's your potassium? What's your iron? Just the basic stuff that we look at to see if you're just a healthy person. Do you have an anemia? Is it a macrocytic or a microcytic anemia? There's a lot of things. Are you deficient in B12? Are you deficient in anything? And this is where you mentioned methylation. This is where that comes in. The cool thing about methylation, it's not like blood work. You have to get it done every 3-6 months or whatever, depending on let's say if I put you on testosterone, initially probably every 3 months I would get blood work, and then after you kind of stabilize and get into a habit of how much you take and stuff, then maybe we can do it every 6 months. But you just have to do it multiple times a year is my point. With a methylation test, you do it one time. It is specific to you. It is essentially a gene test that figures out what you're deficient in. And it's specific just for you. We take all these supplements because we watch them on TV or we hear about them on social media and we're like, wow, this is great stuff. You may be taking this and you don't need it, which most of the time you'll just pee it out and no harm, no foul. But other times is you're taking more of something that you don't need. You could affect yourself to where you would have problems.
Yeah,
you just don't know. But you don't know. You don't know what's causing it. And it's something like you're taking this, and I'm not saying a multivitamin, I'm taking more specific supplements that can affect you. So you have to be very careful with that. And so I see all these biohackers and all these people that are not physicians that are telling you all this stuff. Now, for the most part, what they're saying is true and it's good stuff, but you have to understand that unfortunately, most people aren't like them. They're like super healthy and can afford to get all this organic, food and red light therapy and cold plunge and all this other stuff. And it's nice if you can get those, but the reality is that a lot of people can't afford to get all that stuff, So, and additionally, a lot of people are on some type of medication. And maybe 2 or 3 different medications. And so those nice things, they're scrolling through social media and they see these, oh man, I want to do that. I want to get, not knowing that it could,
counteract the medicine.
Counteract the medicine they're, taking or make it stronger, and cause them some problems, You have to take everything with a grain of salt. Do I like what I hear on social media from these health coaches and biohackers and others? Absolutely, because a lot of them have some really cool stuff. I just want people to be smart in the sense that you do need to talk with your physician or whoever you trust that is a physician of some sort, so that you can make sure that what you're doing is at least okay for you individually. And so that's the only thing that I have issues with. That a lot of people listen to these people and they're great, but you just have to make sure that what you're doing is not going to affect you.
Who are some of your favorite people to listen to?
Oh, Gary Brecka. He's wonderful, and I like it because he's very, he has a big research team that finds all this stuff out, and he does some very good informative type of his podcasts and then certain webinars and things of that nature, and then just posts that he has. What he is telling us is actual things that people can do. And he always says, look, I'm not a doctor, so you need to check with your doctor. And I appreciate him saying that, because you always have to check with your doctor, because people aren't so healthy. Some people are, but a lot of people are not. They're on different drugs for whatever the reason. And so you need to check that out. So I really do like what he has to say. Was it Paul Saladino? He actually is a doctor that, and he knows it, but sometimes, all the things. She goes, don't do this, don't do that. And I'm like, well, hell, man, you can't live. You know, I'm like, well, shit, what am I going to do? My sheets aren't working. I'm getting too much electricity from the TV, or the Wi-Fi needs to be cut off. You know, I mean, there's so many things. And so you got to take everything with a grain of salt. What they're saying is that, you know, it's true and it's real, you know, and yeah, he'll throw out research articles that say this and that, and they're true. Absolutely. But it has to be realistic to people, you know, if that's the case, it would be, it would be hard to do every little thing to make sure you're not getting microplastics, and you're not, you know, you just want to do as best you can, and, you know, at least develop a habit so you can have the least amount of potential of getting microplastics or excess electricity in your system, you know. And so there's a lot of things.